Hi everyone, my name is Brandon, and today I'm going to talk about dosage calculations. And this is specifically geared towards nursing students and students who are preparing to take the NCLEX, so I'm really going to break this down into the most basic parts of these exams. So why is dosage calculation important? And there's a few reasons. The most important reason is that a lot of our dosages in terms of medications, especially with kids, is weight-based. So you might get a kid getting 50 milligrams of Tylenol, and then your next patient 2 minutes later gets 62 milligrams. Every patient might need a different dose, and especially when you're talking about kids or sometimes medications that adults get as well, if you give the wrong dose, these medications can be lethal. A lot of people can die or have serious morbidity if you're giving the wrong dose. So this is absolute foundations in nursing school. A lot of the time, when the nursing school you're in gives you these exams, they really make this exam 100% or you fail. Some programs even give you one chance, and if you don't pass with 100%, you're removed from the program. And some schools give you up to 3 chances, but I've never really seen it anywhere where you can get under 100%. It's absolutely mandatory. And the biggest thing is, it's not difficult. So once you really get the basics down, when these questions come up in your exams or even on your boards, you should look at this and say, oh, this question's a freebie. It's basic math. And really on the boards, it's the only questions that aren't trying to trick you. So before we get into this, there's a couple important things to know about these questions. Sometimes in the question, you'll get something like the patient's age or their past medical history, even the type of medication they're getting. For these types of questions, it's all fluff and you should just not even worry about it. There are questions that are going to come out over your education where you start to question whether or not these medications might be appropriate or not for this patient. But in dosage calculation questions, none of that is important because the questions are not trying to trick you. It's trying to make sure you have basic competency in order to calculate these dosages. Another thing where they are trying to trick you is that you should be paying very close attention to the units in the question. Sometimes they'll give you something like, oh, this is a weight-based question, and the patient weighs 37 pounds. But in terms of medication dosing, we only calculate in kilograms. So they'll give you pounds to throw you off and trick you into skipping a step and then getting the question wrong. This is the only part where they will try to trick you. So you have to pay very close attention to units. And finally, there's a lot of programs that will teach you how to do all this setting up and cross-multiplying. This is very basic math you should be able to do on your calculator over the course of about 15 seconds. So don't overcomplicate it. You should never have to write everything down on paper to get these questions right. I'm going to teach you really basic ways to do these questions easily, quickly, and get it right 100% of the time. So I'm going to break it down first into easy questions, and we'll move on to more complex questions over the course of the lesson. So this is as basic of a question as you can get. A patient has an order for 12.5 milligrams of metoprolol tab PO. Available is 25 milligrams metoprolol tab. How many tablets should this patient receive? Whenever you get a question talking about tabs or capsules, things like that, you should pretty much thank your professor for the freebie, because this is as easy and simple as it gets, and you should never even in any dimension get these questions wrong once you figure out how to do it the first time. All you have to do is take the ordered amount and divide by what's available. So what's the ordered amount in this case? The patient has an order for 12.5 of metoprolol tab PO. 12.5 is the ordered amount. And what is the available? You have 25. Ordered, divided, available. So ordered, 12.5, divided by 25, which is available. And what does that equal? That is 0.5. That is a half a tablet. And that's the entire question. That's the answer. 0.5 tablets. So that question works the other way around too. So let's take the question and change it to 50 milligrams metoprolol tab PO. That is what's ordered, and available is 25 milligrams tab. So what did we talk about before? All you're doing is taking ordered and dividing it by what's available. So what do? You take the 50 milligrams and you divide it by what's available, 25. And that is 2 tablets. And that makes sense, right? If each tablet is 25 and they need 50, you need 2 of them. Just take what's ordered, divide it by what's available. That's all you have to do. So we're going to take another easy question, but we're going to switch it up a little bit. A patient in the ED has a stat order for 15 milligrams ketorolac, or Toradol is the brand name, IV. You have available a bottle of ketorolac IV 60 milligrams per milliliter. How much do you administer? Now, taking out the fact that it's IV, that can scare you and throw you off a little bit, but in the end, it's the same type of question, right? You have an order for 15 milligrams, and you have what's available, which is 60. So what do? Even though it's IV, it's not a tablet anymore. It's the same exact concept. You take what's ordered, you divide by what's available, 15 over 60, and you get 0.25 milliliters, and that's what you're going to administer to the patient. The only difference between IV and the tabs is you can get a little more specific with the decimals. For example, here 0.25, which is a little harder to do when you're dividing up tablets. So we're going to move up in difficulty a little bit. We're going to go to what I consider a medium difficulty question. A patient has an order for 15 milligrams labetalol IV push. Available is labetalol IV 100 milligrams in 20 milliliters. How much do you administer? So you already see what is making this question a little more complex, right? You have what's available, but it's not in a nice, easy dosage. Like if it was broken down already into 5 milligrams per milliliter, that would make life a little easier. But unfortunately, that's not what it is here. So there's an extra step involved, but we're going to start off the same exact way. We're going to take what's ordered and divide by what's available. So we're going to take 15 and divide by what's available, same way we did in the other question. In this case, we're going to ignore the 20 for now. We're just going to do 100. 15 divided by 100, you're going to get 0.15. So where does that extra step come in? There's one number out of all these numbers we didn't touch yet, which is that 20 milliliters. All you're going to do is take that 0.15 and multiply it by the 20. And you get 3 milliliters, and that's how much you're going to administer. This is where a lot of nursing schools get really complex, and they say you should set up cross multiplication and all that, but don't do that. And you're not going to have a chance to really do that on the fly or in an emergency, especially if you're working in an ED or ICU setting. Just do what you've been doing, order over available, and then multiply it by the units, and you get the answer. And that's really the easier and quicker way to do it. So let's do this again. A patient now has an order for 50 milligrams labetalol IV push. Available is labetalol IV 120, which is a standard dose that you'll see throughout your career. How much do you administer? Same concept. Ordered over available. You take the 50 milligrams, divide it by the 100. And what do? You already know. You take the answer and multiply it by the units, which is 20 milliliters. And you get 10 milliliters, and that's your answer, and that's what you administer. Easy and quick. So we're going to turn up the difficulty a little bit more, because we're going to be adding in a weight-based dose. We're going to add, probably as a pediatrics patient. A patient has an order for Tylenol liquid PO, 15 milligrams per kilogram. The patient weighs 37 pounds. How much should the patient receive? So what do we notice here? Like I said before, you have to pay very close attention to the units. It's very easy to just say, oh, easy, multiply, done. But in reality, this patient is measured in pounds. So you have to change that pounds to kilograms. How do you do that? Well, there's a few ways, but the standard that they use in nursing schools is really to divide pounds by 2.2. For example, if we wanted to convert 10 pounds to whatever it is in kilograms, you take 10 and divide by 2.2, getting 4.54. Is it exact? No. But it's the quick and easy way that nursing schools kind of subscribe to in order to make that calculation on the fly. And I'm fairly certain whatever school you go to probably uses the same conversion. So let's go back to the question. The patient has an order for Tylenol liquid 15 mg per kg. The patient weighs 37 pounds. How much should the patient receive? So let's take the 37, and what do? We divide by 2.2, which we're going to get roughly 16.8 kilograms. And again, in this situation, don't clear your calculator. Just use the dosing that you have until the very end, and then you round however your school tells you to round, whether that's the tenths or hundredths. So we now take our 16.8 kilograms that we just calculated and multiply it by the one number we have left, 15. Why? Because it's 15 milligrams per kilogram. Patient weighs 16.8 kilograms, and they get 15 kilograms for every 15 milligrams per every kilogram. And that comes out to 252.27 milligrams. And that's your answer. That's how much they receive. Now, is this how your question is going to show up on the exam? If your professor is nice, then probably. But the way they more likely are going to do it is like this. A patient has an order for Tylenol liquid, 10 milligrams per kilogram. We switched it up there. The patient weighs 32 pounds. And you have available 160 milligrams and 5 milliliters. How many milliliters should this patient receive? So you see, we added a whole new dimension here. So we're going to do the same thing we've been doing though, right? We're going to change the 32 to kilograms. And how do you do that? You divide by 2.2. I gave you the answer there for you, 14.546. Now step 2, how many milligrams is this patient supposed to get? So we're answering it just like we did the last way. You're going to take that 14.54 and you're going to multiply it by 10, in which you get 145.46. So what do you do now? We're going to think back to those medium and easy questions we did before. And what's the formula I've been talking about the entire time? Ordered over available. So the order we have is actually for 145.46 milligrams. They just wrote it funny by making it 10 mg per kg. But 145.46 divided by, what do we have available? 160. And that leaves you with 0.909. Now what do? And if you've really been understanding and you followed along from before, you know that there's only one number left here, which is that 5 milliliters. So we're just going to take that 0.909, we're going to multiply it by the 5, and we get 4.55 milliliters, and that's what we're going to administer to this child. So I added some bonus questions here for you, although I think at this point you have all the fundamentals you need to really pull apart any question that's thrown at you. But sometimes they're going to ask you questions about IV infusions, so that's what we're going to go into here real quick. So a patient has 2,000 milliliters of IV fluids, let's say normal saline, to be administered over 8 hours. How many milliliters per hour do you set the IV pump to? Pretty much same concept as our easy question. You take the order, but instead of dividing by what we have available, we're going to administer by time, and specifically time in hours. So a patient has 2,000 and divided by 8 hours, what does that give us? That gives us 250 milliliters per hour. We're going to make it a little more complex on one last question. A patient has ordered 2 grams of cefepime IV to be administered over 4 hours. Available is 1 gram cefepime and 50 milliliters normal saline. How many milliliters per hour do you set the IV pump to? Now, there is an extra step here. And this one, there's a couple different ways to do it, but this one I think you can figure out mostly on your own. But we have to turn that 1 gram cefepime in 50 milliliters into what they have ordered, which is 2. So you're literally just going to take that whole line and multiply it by 2. So instead now, we have 2 grams cefepime in 100 milliliters. Then we're just going to do the exact same math we've been doing, which is we take what's ordered, which is, now we're going to talk in milliliters. We're going to take what's ordered, which is 100 milliliters, because right, we turned it from 1 gram cefepime in 50 into 2 grams in 100, and over how many hours they want it over 4 hours. And what does that mean for us? 25 milliliters an hour. Now this is almost an exhaustive list of any kind of question you can get on these MedCalc questions. However, the only one that I'm kind of leaving out here is when they want you to calculate drip rate and things like that. And the reason I'm not going to talk about that is, one, it's overly complex. It's the thing that you should really save for last. And two, It's something that we don't really do anymore because drip rates existed when we didn't have IV pumps. So if that's something that your school in particular wants, then you should probably follow the instructions that they gave you for calculating those questions. If your school did not mention it or specifically said the drip rates aren't included, I don't want to include it here to confuse you because it is a very confusing topic. Otherwise, this basic math is everything you need to answer those questions. So best of luck on your exams, and if you like this content, please like and subscribe. I'm going to have more really basic videos on how to handle basic nursing school concepts. Best of luck, and thank you.